April 23rd, 2018 was the worst day of my life. We had taken our son Luke, who was 11 months old at the time, to the emergency room because he was breathing pretty heavy. Everyone just thought he had a virus that had to run its course. But the next morning, he woke up with even more labored breathing, so we took him to the pediatrician's office, and they immediately sent us to Nationwide Children's Hospital.
Everything in triage now is just a blur. It wasn't too long before Luke had to undergo emergency surgery to alleviate some fluid in his lungs. The next time we saw him, he was on a ventilator.
When Luke came to the pediatric ICU, he was very sick. He had a severe pneumonia caused by a combination of viral and bacterial infections, which caused respiratory failure and septic shock. He was placed on a ventilator to support his breathing and required resuscitation with fluids, a blood transfusion, and IV medications to support his dangerously low blood pressure. Septic shock is one of the leading causes of death in children worldwide. It is a life-threatening consequence of severe infection that without timely treatment can lead to tissue damage, organ failure, or death. Our team has been researching ways that the body's immune system works in the setting of sepsis and how best to optimize shock resuscitation to promote recovery. This includes the use of blood product transfusions. While blood transfusions can sometimes be harmful, they are sometimes life-saving. And our research suggests that for some patients, like Luke, blood transfusions may be a key part of the resuscitation strategy that helps to rapidly reverse shock and prevent organ injury. Our ultimate goal is to understand how best to identify which children with septic shock would benefit from transfusion so that we can improve outcomes for critically ill septic children everywhere.
I will never forget the day that Luke came off a ventilator and I was finally able to hold him again.
It was a huge step, but unfortunately, we still had a long road ahead of us. In the hospital, Luke developed a blood clot, which cut off blood flow to his right foot. This caused extensive nerve and muscle damage. By the time we took him home, his foot was stuck in a downward pointing position.
We saw so many doctors trying to figure out what to do about his foot. One doctor even suggested amputation. But luckily, we found Dr. Whitaker at Nationwide Children's Hospital.
When I first met Luke, he came in with a severe equinus deformity, which means that his foot wasn't able to get flat and was pointed down, so he was walking on his toes. I had had success with similar deformities, and we talked about the options and decided to go forward with casting. It was a slow process because of his previous vascular issues. And we just took it nice and slow. And once we were able to get enough movement and stopped seeing results from the casting, then I released his Achilles tendon and was able to get better range of motion. He was then in a cast for about another month, and then we transitioned to a brace and started getting him working with physical therapy to get his motion back.
I met Luke 3 years ago, and he was just a little bit over a year old, and he had already been through a lot. He started physical therapy with a big cast in his right leg, from his foot all the way up to his hip, because he was going through the casting process with Dr. Whitaker to get his foot flat. Luke had started walking before all this happened, so our first goal with physical therapy was to get him used to walking on his cast, and we did that first with a walker, and then we removed the walker. After the cast came off, his right leg and foot were really sensitive. He didn't want anyone touching it. He didn't want to put any weight through it. So it did take a little while to get him used to using his right leg again. Over time, he started getting some muscle function back into his foot, and we capitalized on that with physical therapy. Now fast forward to 2021, he can move his foot up and down. He can actually hop on his right foot, run, jump, climb, ride a bike, do anything that an active 4-year-old would want to do. And it really is a testament to Luke's determination and his family's dedication to the home exercise program. We're so proud of you, Luke.
We are so grateful for the entire medical team at Nationwide Children's Hospital that cared for and continues to care so well for our son.
Thank you, Children's Hospital.